Service excellency, especially in healthcare, is the ability for us to manage and meet the patient's expectations. When patients walk into our facilities, they come with lots of things, not only just their injuries and diseases, but also they come with lots of stress, a lot of worry in life. So it's our responsibility to ensure that we meet their needs beyond just the disease and beyond the injury and beyond the complaints that they've presented with. So it's very important for us to show empathy, to see what they see and feel what they feel. So in doing that, we are putting ourselves in their shoes. We need to ensure that the clients at the end of it all have felt that touch that is going to make a difference in their lives. Some of the clients that walk in may not necessarily have disease.
Operation and facility excellency at CCare in Tinda is a continuous culture of improving the safety, the ambience. We want our clients to experience a home away from home. When they come visit their clinicians or their doctors, the only difference is it's the doctor. Whatever we have put in place is for them to experience their facility of choice. We have made sure that their access to the facility is convenient to that. When our patients come, we have spacious parking at the Intinda complex where they're able to park and they're able to come to see their doctor. We have an excellent team of doctors, administrators, maintenance team. Everyone is excited of giving the patient the best service.
Excellence in pharmacy is achieved through a number of things, including our dispensing practice. We have an outstanding validation process for every single prescription. That includes checking at the diagnosis, at the medication recommended, the doses, and to achieve right medical treatment, which is one of our key patient experience pillars. We have reference books in pharmacy. That is the British National Formulary and the Uganda Clinical Guidelines. We keep track of our prescriptions out. That helps us to know the level of satisfaction of our patients. Every patient would love to live with a drug, and we make sure we avail whatever was out of stock maybe the previous day. We follow up on these patients to come and pick that medication.
Nursing excellence as a manager means relationships, safety. We make sure that the nurses are dressed in their uniform, they have a name tag, so that clients can address them when they're speaking to them. We do infection control and prevention to make sure that the place is clean. We don't transmit infections to our patients and ourselves. We make sure that our equipment are serviced, because when they're serviced, they will give us the right results. For every client who is prescribed medication that needs an injection, we make sure that we follow them up when they leave the clinic so that we see how they are doing before they return for their next treatment.
At CCare, we are committed to excellence, which also involves financial excellence. As this all starts at planning and budgeting and involving all the stakeholders that have to be in the process. Financial excellence involves revenue assurance. And revenue assurance starts from the person who receives the patient, bills the patient, sends over the patient to the last person. The last person closes off the bill and submits the bill for payment. Furthermore, we do monitor our expenses, and this involves all the stakeholders, starting from the admins, the nurses, the lab person, and even the maintenance team. This financial excellence is all achieved through our sustainability program that looks at meeting the needs of the organization currently or in the present without compromising the needs of the future.
We as a region, Kampala Eastern, have been able to achieve financial productivity in a number of ways. Client experience has been the strongest fundamental attribute in achieving our financial productivity. It's very critical in financial productivity to manage costs, and we have achieved this through rightful budgeting, automating manual processes through monitoring tools like Dynamics, and optimizing staffing and scheduling through rota management to manage our queues for the patients.
When a patient walks in, we look at attending to the patient first. Patient care is key in our business. Definitely we explain to them this is what is necessary, but we do not put that at the forefront. We take the patient through the processes, and then after that we are able to, get into the entire business of this is how much we need, this is how the bill is, and this is how we are going to go about the bills. So the first thing we look at is to make sure that our patients are taken care of first, and that has actually helped us to deal with patients, to attend to patients on time, to attend to our patients without them having a lot of thoughts about how is the bill going to be sorted at the end of the day, because of how we relate with them. With CCare, the patients come first.